This year, CBS News has been tracking 4 groups of election influencers who could prove decisive in this year's midterm campaign. One group, pressured parents. They say they're anxious about the post-COVID era, particularly when it comes to their finances and their children's well-being. For a closer look at some of the concerns facing this group, we're joined now by Laura Meckler, national education writer at the Washington Post, Scott Gottlieb, as you know him, the former commissioner of the FDA and a board member at Pfizer, and Emily Oster, an economist at Brown University. And she joins us from Providence, Rhode Island. Good morning to you all. Emily, I want to start with you. You wrote an article about pandemic amnesty. You said basically we need to forgive public officials for what they didn't know during the worst of the pandemic. You had argued early on for opening of schools when the pandemic was still raging. What do you think we need to be focused on now? Because some of the debate still seems to be stuck 2 years ago.
So I'm an economist, but I'm also a parent, and I talk to a lot of parents. And what I can say is right now, parents are very worried about the next steps for their kids. They see the historic test score declines. They see the declines in routine vaccination rates for kids, and they want us to be looking to solutions. They don't want to be looking to rehash the debates that we had 2 years ago. They want to know what investments are we going to make as a policy group to fix the problems that they're seeing for their kids.
Well, amen to talking about solutions, but we aren't, Laura, talking much about them as a country. To those scores that we just heard mentioned, the Education Department reported appalling historic declines. 25% of fourth graders were below the basic level in math. 37% were below the basic level in reading. How much of it is linked to the pandemic closures? How much of it is linked to a broader problem? And why aren't we hearing more about it?
Well, some of us are talking a lot about it. I think that it is really important. We have seen historic declines, particularly in math, but also in reading. And it is certainly linked to the pandemic. Some of it is linked to the schools that were remote for an extended period of time. But even schools that were not remote, also we've seen, that were not remote for very long, I should say, have also seen significant declines in academic achievement. So, and I think that paired with the sort of a social, emotional, mental health real crisis that we're seeing among children and teenagers right now is really putting an enormous amount of pressure on schools and on families.
And to your point, because we looked at it, New Hampshire, which opened earlier, Georgia, Florida, where schools reopened faster, they may have fared better, but they still saw declines. So there's still something happening.
Exactly. And I think that what most experts will tell you is that, the pandemic was still happening, even if kids were back in school. First of all, there were closures, there were quarantines, people were in and out of school. But beyond that, people were experiencing loss. They were seeing stress all around them. They didn't have their normal lives. So I think that, the pandemic had a deep effect on families and on children and on schools. And I think those are going to be continuing for really many years to come.
And I know I don't like it when people say the pandemic's over, because I still feel like I'm living through this haze, Dr. Gottlieb. School closures are still a live issue. We've seen upticks in RSV and flu and other viruses, and some schools have closed. In Indiana, we just saw one, Virginia. Should communities just take this out of the toolkit and keep schools open no matter what?
Well, look, we have a major epidemic of RSV, maybe peaking right now. We're going to enter into a major epidemic of flu, and we haven't been taking the actions that we would normally be taking to try to mitigate these kinds of pandemics, because I think a lot of public health officials, and I think a lot of school districts are a little bit gun-shy right now, given the backlash to what we did during the pandemic. Closing a school for one incubation cycle for 2 or 3 days when you had a major outbreak of flu or RSV in the past was not that uncommon. If you had 40%, 50% of the kids out of school, you might close for a day or two. Now, when a school does it in Indiana, it's national news. We know hand hygiene, for example, is very effective at stopping flu transmission. Do you hear any school district talking about hand hygiene right now? We know wearing a mask if you have the flu or RSV when you go out is effective at preventing forward transmission. Nobody wants to say that. So I think that there's a lot of reluctance now, in part because of the failures of public health messaging during the pandemic and the things we got wrong and the backlash to it. So we don't have a good solution for what we're entering right now.
What do you make of Emily's premise here that there needs to be amnesty?
Well, look, I think we need to distinguish, and she was at the vanguard, to your point, at arguing for schools to open. A lot of kids got back in the classroom because of her efforts. So she's advocating on behalf of others when she talks about amnesty. I think we need to distinguish between structural failures of institutions and mistakes that were made because we were in the fog of viral war and we didn't understand the virus itself. There were institutions that failed, CDC. There were a lot of systemic failures there. Even people talk about the teachers union not working to get people back in the classroom. And then there were things we got wrong. We didn't recognize the virus was airborne. We thought it was droplet transmission, so we advocated the use of cloth masks when they weren't effective. So there were things we did wrong because we didn't understand the virus. We need to learn from that. But I think the structural features that we got wrong, where institutions failed, that we can't move on from because we need to reform those institutions.
Emily, parental rights has been harnessed effectively by Republicans in certain places on the campaign trail, but our CBS News polling shows this is broad concern. To your point, 72% of those polled say they're concerned about learning declines after COVID. 72% said they're worried about bullying at their kids' school. 68% said they're worried about gun violence. 57% said discussions of sexuality and gender concern them. There's so much concern about the classroom. Where does the focus need to be, and where does it need to come from here?
I think that the focus needs to be on what we need to do to move forward for solutions. And, and to give you a concrete example, when we look at something like test scores, which many parents are very worried about, we see that over the last school year, there's been some test score recovery, but that's uneven. Some school districts have recovered to where they were in 2019. Some school districts haven't recovered at all. At this point, if we want to speak to these concerns of parents, we need to think about what are the investments we're making to figure out why have some school districts been successful? What did they do that was successful? How can we port those lessons over to districts that haven't been successful? This kind of solutions-based focus has to be where we go rather than rehashing the discussions we had 2 years ago. That's how we're going to find solutions and get kids back on track, because it's frankly, exactly as you say, kids are really suffering and we're losing time on getting them back.
Laura, the focus that we are hearing about the classrooms is on the content of what's being taught in them. And we saw that in that 57% discussion of sexuality and gender. Is that just because it's easier to access or understand, or why?
I think that the sort of culture wars that have gripped schools in the last couple of years are now coming to the question of gender and sexuality. For a long time, we saw them centered on issues of race, like so-called critical race theory, and there was conversation of discomfort among conservatives of talking about systemic racism, for instance. And that has kind of given way now to concerns around gender identity and transgender women competing in sports. All of those things, I think, are concerns among many conservatives, and there are a lot of candidates for office and political figures who are playing on that and talking a lot about that. And I think when they talk about parental rights, that's what they're talking about. They don't want, they will assert things like, schools are trying to turn boys into girls and girls into boys. I don't think that that's true. But that's the kind of fears that, because I think there's still a lot of discomfort with the idea of questions around gender identity, and there are people really working to tap into that.
Yeah, I mean, what Emily has argued is we need data on how to make up for educational deficits.
Well, this has nothing to do with that.
That's not sexy on a bumper sticker?
Yeah, right, exactly. Yes, that is the core problem facing education today, right now. Actual academics. Can kids do math? Can kids read at the levels they need to? Those are skills you're going to need into your education and into life. These other things are just much more emotional and tapping into sort of these culture war conversations that we're having in this country.
Dr. Gottlieb, I mean, when you look at parents, it's like a formula shortage, completely incoherent messaging from the CDC that you just laid out here, childcare shortages in part due to what's going on with infection rates. It is hard not to have anger and emotion about public health and how it's communicated.
Yeah, look, I think that there's a pervasive sense, rightly so, that public health institutions have failed the public and that they weren't equipped to tackle the challenges that people have been facing. We shouldn't have had the shortage that we had with formula. We should have responded to it more adequately than we did. CDC didn't put out practical guidance, didn't advise families on what to do. Their requirement for 6 feet of distancing is what kept most schools shut well into the spring of 2021. So there's a pervasive sense that public health institutions didn't work on behalf of families. They were slow to integrate new information. And there's not real evidence that they've reformed themselves. There hasn't been an effort by the administration to try to, try to fundamentally reform CDC. CDC is working to reform itself, but that's not usually the way it works. It's hard to self-organize around a new mission if you're an agency. So I think if the administration had been more aggressive at addressing these deficits, people wouldn't feel so much angst.
Or you need to hear that from perhaps the new Congress, the pressure to reform. Emily, you also raise in your article the question of mandates for vaccines. Are you arguing for flu and COVID vaccine mandates? Because that's very controversial.
In the article, I discussed routine vaccinations, measles, pertussis, where we don't typically have mandates, but the rates have been very high. They've gone down over time. We haven't seen schools move to COVID vaccine mandates, and I don't expect them to.
Right.
And similarly, we haven't seen flu mandates, and I don't expect to see those either.
Okay. And I know Dr. Gottlieb also is against mandates.
Yeah, I don't think
flu
this vaccine reaches a threshold of being mandated in schools.
All right. Thanks for all of you. We could do a whole hour or more on all the parental tensions right now, but we got to leave it there.